The stand pivot. Fit the SmartLift vest and apply the knee belt. Move the patient forward in the seat. Place the patient's feet slightly apart and pull the foot closest to the target forward. Push the other foot back slightly. Position the patient and the transfer target so the pivot will be a quarter turn. Place your foot, the one furthest from the target, between the patient's feet and press your shin into the knee belt. Place your other foot behind you in a broad stance. Grab the front handles of the vest and count to 3 to help prepare the patient for transfer. On 3, pull back and transfer the weight from your front leg to your back leg while turning the patient, and then set the patient gently down on the target. Reposition them if necessary. Key points on the stand pivot. Fit the SmartLift vest and knee belt. Use of the knee belt may not be needed for patients who can participate in standing during the transfer without a high risk of knee buckling. Patient's foot placement. The foot closest to the target is forward while the other is slightly back for a smooth pivot. This prevents their feet from tangling during the pivot. Caregiver's foot placement. Place the opposite foot from the target between the patient's legs. If the knee belt is indicated, press into it using your shin. The other foot is positioned behind you to broaden your stance. Shift and pivot. Pull the patient up while shifting your weight from the front foot to the back foot while pivoting.